2. Great. So, welcome to the first session of my conversations in the podcast setting. And I am so happy, to have Laurie working with us in the clinic. Laurie is an acupuncturist and a yoga instructor and has been working at the clinic for about 4 months. And we're going to have a little chat about what acupuncture is all about and things that it can help, and her perspective on some of the theories and the grounding aspect of acupuncture and why she loves it. And she loves it. So
I do
I
love
know,
it.
I know you do. You're so passionate about it because when you're working and I've had acupuncture from you, you're just so excited and you're so like, oh, I can do this. It's like all the puzzle pieces come together and I
Yeah,
can just see everything like tick, 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 tick in your head, which is just
yeah.
lovely.
It's really lovely to
Mm.
connect like the Western thought processes with the
Mm-hmm.
Eastern. And when they
Mm-hmm.
do fit like a little puzzle piece, I get very
Mm-hmm.
excited.
Yeah,
Love to geek
exactly.
out just like you do.
Yeah, absolutely. So the first question I have, which I most commonly hear, is, does it hurt?
Yeah, and
Mm.
that is a super common question. I think the answer is generally no, it doesn't hurt. The needles are so thin. So I think some of the needles I have, you can fit probably 20 plus in an intradermal needle. So they are really small needles.
Mhm.
And might you feel an insertion? Yes, you
Mm.
can.
Yeah.
Does it hurt? Not necessarily.
Mm-hmm.
You might feel like a tiny little prick,
Mm-hmm.
but sometimes you don't feel it at all.
Mm-hmm.
Sometimes you don't feel the insertion, you don't feel the manipulation.
Mm-hmm.
But if you have a bigger needle, you might feel the insertion. And
Yeah.
also, if the point of the acupuncture point that you're doing there is to vesiculate a muscle,
Mm-hmm.
you might feel that.
Right.
I would say most people describe the sensation of an acupuncture needle as being dull, achy, which is a
Mm-hmm.
really good sensation to feel.
Mm-hmm. I
Um,
describe that as the.
yeah, yeah, exactly. So there's like an interesting sensation that comes with that.
Mm-hmm.
There can also be a deep sensation. There can be a tingly, burny. I mean, there's all sorts. I always tell everyone that the only sensation I don't want you to feel is a sharp needle feeling.
Mm-hmm.
Everything else that you can feel with the needle, it's usually quite subtle. Um, that's all fine.
Yeah.
And they usually dissipate within 30 seconds of
Mm-hmm.
sitting with the needle.
Mm-hmm.
But if
Yeah.
someone's afraid that a needle hurts, it's so
Mm-hmm.
very easy to just
Yeah.
pull it out just a
Yeah.
teeny tiny
Yeah.
bit or manipulate it in such a way that you
Mm-hmm.
won't feel it.
I have to say, I've probably had acupuncture from 4 people, and the acupuncture that I've had with you has been the least painful.
Really?
I
Oh,
really find you very sensitive and actually very skilled at knowing how to apply it in a sensitive way,
yes.
which I
And
appreciate.
oh, well, I use smaller needles because I
Mm.
also appreciate when it doesn't
Mm-hmm.
hurt.
Yeah.
So there are like so many different sizes of needle,
Yeah.
and I use like a Japanese style needle.
Mm.
And you can use a Chinese style needle, which you
Mm-hmm.
would do if you're
Mm-hmm.
using a big needle.
Yeah.
Not to scare anyone, but you can get quite long
Yeah.
needles. And when you
Because
do,
in certain places of the body, you need to have some of that depth, and especially for different body sizes and for different effects on the tissue, right? And you
exactly.
mentioned the muscle fasciculation. So you want to describe a little bit what fasciculation is?
It's basically, in layman's terms,
Mm.
just a contraction and
Hmm.
a release of a muscle.
Yeah.
It's just
So
muscle
make it
fibers kind
twitch
of,
for a minute and it,
it's a
yeah,
twitch,
yeah.
exactly. And it's really quick. But yeah, for a muscle like, say you're doing that in the glutes, which is a really easy
Hmm.
place to vesiculate a muscle,
Hmm.
you get a nice long needle, you get into the glute
Yeah.
muscle. Usually it actually feels quite good.
Yeah. Yeah.
I don't really have anyone who hates the feeling of the
Yeah.
muscle
Cool.
vesiculation.
Absolutely.
Yeah.
That's good.
Yes.
Thank you. Okay, so as somebody who is an osteopath and who works with dry needling, people often say to me, "Oh, you do acupuncture, that's great." And I always say, "No, I do dry needling." So can you explain the
Yeah.
difference between acupuncture? Because I think it's really important.
It is really important. I think it's very important for acupuncturists and people who practice Chinese medicine that we differentiate between dry needling and acupuncture.
Mm-hmm.
But when it comes down to it, sometimes in acupuncture, we do dry needling.
Mm-hmm.
So dry needling itself is really just, it's very much musculoskeletal. It's using a needle, which is the same exact needle that I would use.
Hmm.
And it's getting into the muscle layer, and it's usually helping a muscle to relax, which is exactly what we were just talking
Hmm.
about with
Hmm.
muscular resiculation.
Hmm.
Acupuncture is different because it is an entire medical system that was developed 2000 plus years ago.
Hmm.
Some say like 4,000 years ago, and it's used for everything. You can use it for pain and musculoskeletal issues, but that's kind of just like the tip of the iceberg. And
Hmm.
like if we talk about yoga, asana and practice, like just
Hmm.
like moving your body is really just also the tip of the iceberg.
Yeah.
So those two things, most people kind of relate to acupuncture as, I've got a shoulder pain, so I went to my acupuncturist, but the amount of things that you can treat with acupuncture are pretty much limitless.
Hmm.
I always say to people who are curious that, if you would see your GP for an issue,
Hmm.
be it digestive problems, hormonal issues, infertility, headaches, allergies, sleep problems, anxiety, anything that you might see a doctor for, you can
Hmm.
see an acupuncturist for.
Hmm.
That's
Hmm.
not to say that we can cure something,
Hmm.
but that we look for the root cause with acupuncture.
Hmm.
And yeah, through Chinese medicine diagnosis, we work with different meridian systems that, fit that
Yeah.
diagnosis. And then those points are used to bring harmony to the body. And oftentimes we don't even get into the muscular layer.
Yeah.
So sometimes if we're needling for stress, you might only put the needle in with just a tiny little tap and you don't manipulate it at all, which is
Hmm.
much different from dry
Hmm.
needling.
Yeah.
But with that said, like I said at the beginning, you can literally, dry needle
Yeah.
with acupuncture. And, ironically, there's no such thing as a wet needling.
Yeah.
That's not a thing.
Yeah.
So dry
Well,
needling is just the
absolutely.
name.
Absolutely. And for me, the way I differentiate that is like if you have a wet needle, you're injecting something into somebody, that's the wetness, right? And that it's the needle is there as a carrier system rather than as a catalyst to make change on very well studied researched points. And I think it's really good to know that acupuncture is actually one of the most researched, evidence-based natural health modalities that we have,
Oh,
right?
yes.
Mm-hmm.
Yeah. It's really lovely for you to hear you say that
Mm-hmm.
too, because a lot of people think that it's just energy work and it's quite woo-woo or a little
Mm-hmm.
bit esoteric, but you know, it is in some senses there, you don't want to take that kind of like the mystery away from it, but there's so much science to
Yeah.
it.
Yeah.
Um, and there's been a lot of research and there's tons of
Mm-hmm.
meta-analysis
Mm-hmm.
on like what acupuncture can do because
Yeah.
we do acupuncture on people and things happen and things change.
Mm-hmm.
And you go, I don't know how.
Mm-hmm.
But like, and then if you look at the research, it's usually quite it's quite watered down in the way that they can't tell you exactly how. They can tell you some of the mechanisms,
Mm-hmm.
but there's still a little bit of mystery to
Yeah.
why certain points
Mm-hmm.
have an effect
Mm-hmm.
better than other points.
Mm-hmm. Yeah. Yeah, absolutely. And actually, the British Acupuncture Association, I think, has a lot of great research and free resources on their website. I know you train and you're from New York and trained in New York. You're from New York as
I'm
well.
from New
Yeah, I
York.
thought so. I was questioned myself for a minute there. Um, but the BAA does have a lot of really great like resources as well online, and they're worth checking out if you're in doubt at all or
Yeah. And also popped my Instagram page because um
every day
I'll
she's
put
got something.
studies
It's like I'm like, oh
out
my
there.
God. Absolutely. Yeah.
People love to know that there is science
Yeah.
behind it. But
Yeah.
I think the best like research you can do is go get it and see how you feel afterwards.
Hmm. Hmm. And
And
don't just give it one go. Like I think that for a lot of people, they're like, oh, it didn't do anything for me, or you cannot expect, I think, and tell me if I'm wrong, acupuncture to be a one or two treatments and then you'll know and you should be treated.
yeah, and sometimes it is.
And I think,
Annoyingly, sometimes some people
and are there
respond really well.
particular conditions then that respond better in that way?
Yeah, there are some musculoskeletal things if it's a
Mm-hmm.
brand new injury, something acute
Mm-hmm.
that you really just are having pain.
Mm-hmm.
I've had a couple of patients, you see them once, you never see them again. You
Yeah.
go, oh my gosh, did they hate it? But then you get
Yeah.
a message and it
And they're
says,
like,
oh
I
my
felt
gosh,
amazing.
it's fixed. I never
Mm-hmm.
needed to come back. And
Yeah.
it's really good to hear that.
Mm. And so it
Uh,
controls pain and inflammation
it
at the
can
tissue level.
modulate, yeah, it
Mm-hmm.
can modulate pain. But also like dry needling,
Mm-hmm.
if you're going in for a muscle that's
Mm-hmm.
like bound up and tight,
Mm-hmm.
you can release that
Yeah.
muscle and you can ease
Yeah.
someone's pain. Um, I would say sometimes it gets fixed in one treatment, and sometimes there's things that, depending on your age, how long the issue has been going on for, it
Mm-hmm.
might take a long time. So
Mm-hmm.
the longer, the more chronic that you've
Mm-hmm.
had something, it's not like you have high blood pressure and you take one beta blocker and you're
Yeah.
fixed.
Yeah. Yeah. Yeah.
You kind of
Yeah.
you have
Yeah.
to stick with it.
Yeah.
It's just like diet and lifestyle.
Yeah. Yeah.
Yeah.
Absolutely.
Yeah.
Okay. Thank you. I'm just gonna see what I've written here. Um, I think we've really spoken about that. So a lot of people think so that the meridians might be like the large intestine, the liver, the heart meridian, but these don't really relate to the organs specifically, do they? Like if you have the liver
Correct.
meridian, it doesn't relate to the function of the liver.
Correct.
Okay.
And that's something that's really confusing, which is
Mm.
why oftentimes when people ask me for their
Mm-hmm.
diagnosis,
Mm-hmm. Mm-hmm.
I'm really hesitant to say, oh, you have um, liver qi
Yeah.
stagnation. I'm just pulling that one out from
Yeah,
nowhere. But,
yeah.
but because they say, oh my gosh, what's wrong with my liver? But there's nothing wrong with the liver.
Mm-hmm.
In Chinese medicine, we relate organs to so many different
Mm-hmm. It's because it's an energy
functions.
system as well, right? So it's an expression of energy.
Yeah.
Tell me more about that.
Oh gosh, yeah. So every single organ system has its own functions and its own behaviors, for
Mm-hmm.
lack of a
Mm-hmm.
better word.
Yeah.
And since we're on the liver, we'll just talk about the liver. The
Sure.
liver it controls the free flow of qi.
Mm-hmm.
And qi is one of those things that, we'll get into, I'm sure, at some point.
Mm-hmm.
But the free flow of qi is really important. So where there is stagnation, there's pain. And when
Mm-hmm.
there's pain, there's stagnation. So if we see like a painful area, we can also say disease
Mm-hmm.
in kind of over
Yeah.
pain,
Or
one or the
dip
other.
ease.
Dis-ease, yeah.
Mm.
So chi it needs to flow freely,
Mm.
essentially. So the liver controls that.
Mm-hmm.
When the liver is stagnant, you can get stagnant chi. It doesn't necessarily mean there'll be pain. There could be
Mm-hmm.
disease. A lot of the times, I think the liver's stagnation kind of manifests in emotional issues. So, and not, this doesn't always have to relate to the liver. This is what
Mm-hmm.
makes Chinese medicine so complicated,
Yeah.
is that, let's say, anxiety
Mm-hmm.
in an Eastern sense, we
Mm-hmm.
wouldn't call it anxiety. We might
Yeah.
call it liver qi stagnation,
Yeah.
but we could also call it like heart blood deficiency, which
Mm-hmm.
has nothing to do with your heart.
Mm-hmm.
You're not like losing blood.
Mm-hmm.
You're fine. But there's a lot of different things that can relate to that. So with that being said, I could get off on a tangent on this.
Love it.
But no, it's so complicated to
Yeah,
explain.
absolutely.
But I just lost my train of thought. The way that Western medicine describes something, like I gave that example of anxiety. In Eastern medicine, we don't call it anxiety. We call it, what's the underlying pattern of
Mm-hmm.
disharmony within the body.
Mm-hmm.
And that might be related to liver, it might be related to heart, it might be related to spleen.
Mm-hmm.
And all of those things you can look at and say, I see how that could be called something else
Yeah.
in our, allopathic medicine. For
Yeah.
example, something going on with the spleen. It could be that you have like gut dysbiosis,
Mm-hmm.
and that's causing anxiety. So
Mm-hmm.
there's a lot of different things, but in Chinese medicine, it's never just the
Absolutely.
disease.
Yeah.
What organ system is out of
Yeah.
balance and how can we bring it into balance and how does that affect the diagnosis that we
Yeah.
talk about?
Yeah.
Yeah.
Yeah. And I think that is the real skill of acupuncturists as well, is to be able, and that's the puzzle,
To
right?
discern.
Is to exactly like how is
Yeah.
this on this day, in this moment, in this life experience this person is having, who seems to be more, let's say, liver, chi stagnant overall in the way they're going to present. If things are a bit stagnant or low, then what is it connecting to? Is it more like oriented about the spleen? Is it more oriented around the heart? How can we bring these other things in to support and nourish and improve the flow? And um, and I think that is the real skill of acupuncture and the real gift of acupuncture. It's genius, right? And like, my
Yeah.
God, it is genius.
Yeah.
And it's really powerful. And you don't have to feel like smacked around the head, like you're taking loads of painkillers or medications to like resolve your problem. It's not necessarily going to be endlessly like years down the line that you have to do these things. I think it's a real way of understanding yourself and attending to yourself
Mhm.
and your energy systems. And let's talk about chi, seeing as we're
Oh
here,
gosh,
because
okay. It's so hard to describe. It's the word we use all the time, and to
so
put a
I tell you what
definition
it
to
makes
it.
me think of, right? Because in transactional analysis, which is the type of counseling that I do, we talk about physis, which is the Greek word for your life force, your vitality. And
There you
that
go.
is what
Yeah.
I kind of think of in a physical term, chi is.
Yeah. And I think it's been really watered down, and we call it energy because we don't really know what else to
Yes.
call it
Yeah.
because we can't see energy.
Right.
We can measure energy, which
Mm-hmm.
actually is a great way to define it, is because
Mm-hmm.
chi, you can't see it,
Mm-hmm.
but you can feel it
Mm-hmm.
and you can measure it.
Mm-hmm.
And there is, like,
Right, right. And that's why I think the conversations like this is so important because that's why people love going to the doctor because they get a test when they have symptoms or they have signs and they get a prescription for it or they go and get another test and it is all very palpable and physical and
understandable. Yeah.
seeable, right? And there's a cause and effect type of thing in both directions of
Yes.
right, which there doesn't feel to be as much of with acupuncture.
Yeah. Well, what
But I think
happens
there
when you
is.
go to the doctor and they can't figure out what's wrong with you?
Yeah.
And you have symptoms and you can feel them and you know they're there, but they're saying
Mm.
you're fine.
Yeah, that all that whole subclinical
Yeah.
presentation of stuff that is just life.
Yes.
Hmm.
So, well, anyways, chi, let's get back to tea.
Divergent, sorry.
Yeah, chi is quite difficult to explain. I love how you explain it, and I have patients ask me all the time.
Hmm.
Nobody asked me today, but last week they did. And the best word that I can come up with is life force, vitality. But it's more than that.
Yeah.
And the symbol for chi in Chinese is fire and rice and steam.
Okay.
So
Yeah.
it's a fire cooking rice, and chi is like the steam
It's
that's created. It's
transformation.
transform.
Mm.
That's what it is. Chi is transformation. It's
Yeah.
vitality and
Yeah.
transformation. But yeah,
Nice.
that's what it is. And
Hmm.
it is life force because without chi, you're
Hmm.
done. You're
Hmm.
you're you're dead.
Yeah.
But yeah. Oh,
Cool. Cool. Love it. Okay. I got more.
I'm goody.
So, you use different ways of diagnosing to like once you've taken a case history and you've got a bit of an idea then about maybe what this person's dominant like meridian system is and stagnation, etc. is, and so you're starting to form your diagnosis, and then you'll use other things like the pulses and the tongue
Oh
and like
yeah.
all of that good stuff. So, talk to me a little bit about that.
Oh gosh, yeah.
We all
How much time do we
hate
have?
having our tongue looked at, but it does give a hell of a lot of information. If Laurie looked at my tongue now, in fact, you can look at my tongue now,
Okay, let's
and
have a
then you
look.
can, okay.
Oh yeah. Okay.
Uh,
Did you eat anything before you came here?
I don't think so. I might have drunk tea.
Okay. Yeah, so let me have another look. So the tongue is really interesting because there's so many things that you can see on the tongue. So within the tongue, you can close your mouth if you'd like.
Thanks.
Sorry. So you've got all the different organ
Mm-hmm.
systems. You've got what we call the lower jiao in the back. So you've got large intestine, you've got kidney, you've got the liver and gallbladder on the sides, you've got the stomach and spleen in the center, you've got the heart and the lung in the front. So there's so many diagnosis tools.
Love it.
We've also got the pulse.
Mm-hmm.
So, and there's a million different ways to take pulses.
I love that this isn't just a pulse. There you can feel three different pulses on the
Yeah.
pulse line.
So actually we're feeling 18
yeah.
different
Oh,
pulses because we feel 9 different pulses on each side. But
yeah.
I know.
Sensitivity.
Yeah, and it takes a long time. I'm not saying I'm an expert in it, but
Yeah.
you get the general sense to the
Mhm.
organ systems. And
Mhm.
just like you see the organs in a microsystem of the
Mhm.
tongue, you
Mhm.
can see the organs in the pulse as
Okay.
well.
Yeah, so tell me what you saw in my tongue, and then you can check my pulses and see how that is supporting what you see in my tongue.
Sure. And I think it's really important to say
Yeah.
that when I look at your tongue, I'm going to say things that people are going to be like, what in the heck does that mean?
That's fine. That's why we're
But
here.
yeah, stick your tongue out one more time. So first thing, you're going to look at the overall color of her tongue, which is it's almost purpley.
Uh-huh.
It's quite dry. There's a very thin coat in the back. So the
Uh-huh.
thin coat is very healthy, very constrained edges,
Uh-huh.
and then a little cleft right at the heart. That
Uh-huh.
actually means you're really sweet. Usually people with a little cleft are like quite sweet.
Nice.
But you've also got some Chong beams.
Uh-huh.
And this is all very, very complicated because now we're getting into the eight extraordinary vessels and Chong beams, it all has something to do with blood. The color of it is more like a blood stasis.
Uh-huh.
And it's a little bit dusky.
Ah.
But overall, you can see some constrained edges, which just means like liver chi stagnation, which Monica is a little bit livery, and you can tell. I'm not a five elements acupuncturist. I'm a classical acupuncturist, but in five elements acupuncture, we look at the person immediately,
Mm-hmm.
and you look at their build, their stature, and the way that they approach you, the sound of their voice, the smell of the person, which is very, very subtle. I'm not quite there yet when I can smell a person, but I do have a five element acupuncturist who I go to who can pick that up immediately.
Wow, incredible.
Yeah,
Love
but
that.
you can see that there's some liver
Mm-hmm.
signs on your tongue,
Mm-hmm.
and there's a little bit of like a blood stagnation sign in your
Mm-hmm.
tongue. And then the
Okay.
Chong beams are just more like we'll talk about like uterus and blood and stuff like that.
Okay.
Yeah.
Okay.
It's not an unhealthy tongue by any
Yeah.
means. And
Right.
people get really scared when we start throwing out words like liver and heart, and they're like,
Mm-hmm.
oh my gosh,
Yeah.
like we said, what's wrong with me? Nothing.
Nothing. Yeah.
Like,
Mm-hmm. Absolutely.
it's just that there are imbalances that we could bring back to harmony. There are imbalances that might not be causing any problems at all,
Mm-hmm.
that might in the future, or
Mm-hmm.
honestly, that might not in the future,
Mm-hmm.
depending
Mm-hmm.
on how you're taking care of yourself
Mm-hmm.
and all of that stuff.
Yeah.
And then with the pulses, we look at different organ systems. We've got
Mm-hmm.
yin side of the body, yang side of the body. We've got yin pulses and yang pulses,
Mm-hmm.
which are annoyingly flipped.
Left is yin and the right is yang.
The left pulses are yin and the right pulses are yang, but the right side of the body is yin and the left
Right.
side is
Okay,
yang.
so everything about the right side of my body is yin.
No, not everything.
Oh.
Because Chinese medicine would only be interesting if we made it very complicated.
Cool.
So there's something about when you're in utero, you're
Yeah,
upside down.
because we spiral
Yeah.
as
And
well.
so it does switch.
So relevant.
So everything outside of utero, so pulses, we're gonna
Yeah.
just keep the
Yeah.
prenatal for the pulses, but for the human body, you're switched. So everything outside of utero, women are always right, and you can remember it like that.
Okay.
And men are never right. Men are always left is what I meant to say.
Easy.
Oh gosh, I've just lost 50% of the audience. But yeah, so we look at the pulses in three different positions. And then you've got three different layers. So you've got the superficial, the moderate, and the deep,
Okay.
which correlate to the chi, the blood, and the
Mhm.
yin.
Right, gotcha.
And yin in Chinese
Okay.
medicine is the
That's why I know that.
substance.
Yeah.
And you can have thick substance, thin substance, clear or turbid.
Right.
And we think of substance outside of blood that are fluid. So
Right.
interstitial fluids, tears, saliva.
Yeah.
But also yin is it's just the fluid of the body.
Mhm.
Yin and blood are,
Mm.
really important.
Right, yeah,
As
completely.
we age,
Yeah.
we lose them.
Yeah.
So as
So it
we
makes
get,
me think a little bit about like feminine energy, and we all have masculine and feminine in us, right? And the feminine is the kind of flow aspect, the creativity, the intuition, right? So,
Mhm. Yeah. And everyone has all of it within them.
yeah, totally.
Yeah. So on this side of the pulse, we feel for the heart pulse, which
Mhm.
is in the most distal.
Mhm.
And then in the center, we've got the liver. And
Mhm.
then in the most proximal, we have the kidney yin.
Mm.
And in some, not in my lineage of pulse taking, but in some, you'll also have the small intestine, you'll have the gallbladder, and you'll have the urinary bladder.
No, okay.
But that's
Nine,
not how
nine's good.
yeah, 9 is fine.
9's good.
9 is fine. So we're just feeling lovely pulses here. A little bit thin, a little bit tight, a little bit vibration, but all of this just gives me information about how the organs are functioning. And I don't mean the organs, I mean the organ systems,
Yeah.
the meridians.
Yeah.
They're not really the meridians, it's the organ systems that are related to
Okay,
meridians.
I'm with you. Would you like to look at this side as well for completion and then
For completion.
Yeah.
And then over here we have lung pulses, which is a little bit thin and a little bit quiet at the bottom. We've got spleen, which feels quite not much, to say about that one.
Mm.
And then kidney yang, which she's got,
Good. It's
yeah, all the
there.
way. Well, I mean, I'm not going to give you too many details,
Mm.
but it's all the way to the bottom.
Hmm.
It feels strong enough. And we
Great.
know that you have good abundant energy
Hmm.
and it
Hmm.
shows in your pulses.
Yes.
Yeah.
How does it match my tongue on what that told you?
So I would say this side is much more related to what's going on in your tongue.
Hmm.
Thin, a little bit tight, and a little bit of vibration is what I'm feeling.
Hmm.
Uh, the spleen pulse, the
Yeah.
heart pulse, and
Hmm.
the liver are all
Hmm.
related to blood. They all
Hmm.
have a really strong blood function.
Hmm.
So those would be, after I looked at if I looked at your tongue first,
Hmm.
I would say, let me pay most attention to these pulses and see
Right.
how they match.
Yeah.
So it's not always, and I'm sure there are some very, very good Taoist priests who could basically take a pulse or look at a tongue and not have to do anything else and know
Yeah.
exactly what's going on with
Yeah.
you. But usually what we do is we talk, we figure out like what
Hmm.
direction, where's the imbalance, and then what systems we want to kind of focus on
Hmm.
and really see what's going on.
Hmm.
Because
Hmm.
it's kind of easy to get really convoluted in everything that you could find within a pulse
Hmm.
and a tongue.
Right. So what would be your goal in your needling of me?
My goal is always, I mean, this is sounding a little, my goal is always to make sure that whatever the patient's chief complaint is that it's addressed,
Hmm.
even if
Nice.
I don't find it in the
Yeah.
tongue or the pulse, no
Right.
matter what.
Okay.
And that could
I like
just be
that.
something
Hmm.
that's pain.
Hmm.
But if we do a needling at the beginning and you come in because you're feeling really anxious, I'm going to
Hmm.
be keeping an eye on what's going on those pulses.
Hmm.
And at the end of the treatment, I might feel them again. And if they've softened,
Hmm.
then I'm happy.
Hmm.
If they've
Great.
settled, if they were feeling a little bit wiry or tight, like guitar
Hmm.
stringy, I
Hmm.
just want to see them soften.
Mm. Yeah.
Yeah.
I really like that about the way you work because it's so easy, I think, when you're the practitioner to just be the practitioner. And we really have to account for what's happening for the patient, for the person that's walked in the room, what they're experiencing, and not be the one who knows best.
Hmm.
And I think it's so easy as a clinician to lose sight of that sometimes. And I love the way you make that such a priority to
Yeah. It can be.
really account for the
eh,
person, what's
Thank you.
happening.
Yeah,
Yeah.
and it can be quite hard because some people come in with a chief complaint and
Hmm.
you're looking at them and you're like, "Oh, honey,
Yeah.
this is what you need."
Yeah.
And like as you know, you always have to treat what they've come in for,
Yeah.
but I sometimes will just be like, "Do you mind if we put a few extra points
Mm-hmm.
in here while we're here?"
Absolutely.
Because if they can benefit
That's
what's
it.
really
And
going
being able
on.
to explain it to them, right? Like why that is going to have an impact potentially on what they're experiencing as well. Or, if the rest of their system is supported, is nourished, is flowing, is vibrant, then the thing that's a
Yeah.
problem for them experientially will become easier to manage.
Exactly.
Hmm.
Yeah,
Hmm.
everything is better when all systems are functioning on
Hmm.
all
Hmm.
cylinders.
Hmm.
So
And
that's
no system works on its own. All the systems work together ultimately, right?
exactly,
So yeah.
as you know, as an
Mm.
osteopath,
Mm.
nothing is a standalone piece of equipment. Yeah.
So you've kind of touched on this a little bit already, but I mean, acupuncture can treat such a wide range of things. But I really wanted to look at obviously back pain,
Oh,
headaches
yeah.
and migraine and gut issues. So pick up on any or all of those as you feel.
Oh gosh, yeah.
Yeah,
Back pain, I bet, is probably the number 1 reason that you see people coming into the clinic.
definitely.
It has notoriously been the number 1 reason that I've seen people. It's kind of changed, it's shifted,
Yeah.
and but back pain is everybody has back pain, and I don't know, is it from
Hmm.
sitting at a computer all day? Is it
Hmm.
from, someone's a gardener or a carpenter
Hmm.
and they're constantly
Hmm.
working and they've overdone it?
Hmm.
But back pain, I mean, well, I just made a post on Instagram and it was like back pain comes from so many places.
Totally.
And there's muscle testing that we can do to try to figure out where it comes from.
Hmm.
There are also general protocols in acupuncture that are great for back pain. There's
Hmm.
certain points that are like, command point for the low back, command point for the mid back, and those are points that are really good to just like modulate pain in those
Yeah.
areas. So those are great tools to start with. But then you can also dry needle. as an
Yeah.
acupuncturist. I
Yeah.
wouldn't call it dry needling.
Yeah. Yeah. Yeah.
I would just say it's acupuncture,
Mm-hmm.
but you can use those tools that are
Mm-hmm.
dry needling
Mm-hmm.
if you can kind of focus in on say, well, you do a lot of this behavior or
Mm-hmm.
this movement, or you
Mm-hmm.
have this pattern of non-movement,
Mm-hmm.
sitting,
Yeah.
and then you can tap into those muscles. You can feel the muscles where they feel tight and
Mm-hmm.
like actually manually release them with a needle.
Mm-hmm.
Generally speaking, I like to also give stretches
Nice.
and exercises
Good. Yeah.
afterwards
We love
because,
that.
yeah, I mean, I think it's a really nice holistic way to
Mm-hmm.
treat pain.
Mm-hmm.
And then obviously, depending on how long the person's had the back pain,
Mm-hmm.
is really gonna matter
Mm-hmm.
on
Mm-hmm.
how many treatments they're going to need or
Mm-hmm.
how often they need to go home and do their homework.
Yeah.
Or do they have to
Absolutely.
change their pattern
Mm-hmm.
of
Yeah.
breathing, sitting, standing, walking,
Yeah.
exercise, whatever it is that they
Mm-hmm.
do? So
Mm-hmm.
back pain is a complicated one
Yeah.
because there's so many aspects that,
Absolutely.
and some people have back pain that you think, oh gosh, that's not your back at all.
Yeah. Yeah.
That's something else
Yeah.
completely pulling on
Mm-hmm.
these muscles and creating
Mm-hmm.
imbalance. But
Mm-hmm.
we can pinpoint it.
Mm-hmm.
We've been trained in muscle testing. I've
Yeah.
got 4 years of biomed underneath my
Love
belt.
it.
We can do,
And you were a competitive sportswoman yourself.
yeah.
So you got that
I
aspect
have
as
a lot of
well.
pain myself, which is actually how I came into acupuncture
Mm-hmm.
because I thought acupuncture was just for pain
Yeah.
management.
Right. Yeah.
And then I went
And
to
then you were
school
like,
and I
oh
was
my God.
like, what have I gotten into?
So when you were cycling, was that the main cause of your back pain, you think?
I didn't have back pain. I was running and I was cycling and I had
Mm.
hamstring pain
Mm-hmm.
and I had knee pain
Mm-hmm.
and I had foot pain
Mm.
and I had neck pain
Mm.
because you're constantly
Yeah.
looking over your
Yeah.
shoulder.
Yeah.
Remember, I'm on the right side
Yeah.
of the road, so I'm always
Yeah.
looking this way. So,
Yeah.
so yeah, I had tons of
Oh,
pain. Um, I could use a little bit of you too.
wait.
It's been a while since I've seen an acupuncturist, but that's how I got into it.
Yeah.
So it was pain.
Mhm.
Um, you know, and I see so many people with pain, and it's back pain, it's shoulder pain, it's
Yes.
knee pain, and
Yeah.
hip pain.
Yeah. Yeah.
So, as you know,
I concur.
yes. And then some of the other things we talked about, or you asked, was digestive issues.
Yeah.
So, digestive issues are really interesting
Mm-hmm.
because they can also stem from a million different places.
Yeah.
So, I should probably say that about everything.
Well, like we
Everything
say,
has a
because it's
pattern.
all connected as well,
Yeah.
right? But that whole vagal system
Oh,
into the
don't
gut.
get me
Here we
started.
go. Sorry.
The 10th cranial nerve, the love of my
Yeah.
life. Yeah, so there's that. So
Yeah.
there's obviously, if someone comes in with digestive issues and
Mhm.
they're the most high-strung person you've ever seen who breathes into their
Yeah.
chest and their shoulders, and you're like, okay, well,
Yeah. Just need to.
this might not have a lot to do with your gut bacteria.
Yeah.
Maybe, but
Yeah.
let's start with just like
Absolutely.
tapping into the parasympathetic and
Yeah.
getting out of fight or flight.
Absolutely. Absolutely.
So
Yeah.
digestion is one of those things.
Mm-hmm.
So, I mean, so many things to
And
say.
for things like celiac disease and that whole gamut of stuff, IBS, which is a really
Mhm.
common, right? And can actually be incredibly severe and limiting.
Yes.
We kind of palm it off, oh, it's just IBS, but can be a really, really crippling thing
Yes.
to experience and affect somebody's life.
Yeah.
So, talk to that a little bit.
Yeah. So, I mean, the same thing kind of applies where everyone has a pattern. And in
Yeah.
this case, it's less about the pattern of movement and everything we talked about for back pain. And it's more about looking at the person's constitution.
Mm-hmm.
Is there an elemental imbalance in 5-element
Mhm.
style acupuncture? Looking at what's going on in all aspects of lifestyle.
Yeah.
And how that's affecting them, feeling pulses.
Mm-hmm.
It's not necessarily that we're going to be looking at the stomach meridian or
Yeah.
the spleen meridian.
Yeah.
It could be a myriad of things.
Mm-hmm.
So I can't really give one direct answer
No,
to
that
say this is a
and
great
yeah, no,
point for
totally.
digestion.
No,
but
I wouldn't want or expect that. But I think like that conversation around why acupuncture can help gut issues and why you will look in quite a diverse way, in an integrative way, I think is helpful. And it's not just to say, oh, you resolve a bit of constipation and diarrhea or, a bit of like gut bloating or anything. Like there are really significant diagnoses that actually acupuncture can really support.
Yeah.
And even if you're taking medication, I think it is really helpful to look at supporting the system when we get down to the chi level of the
Mhm.
conversation again, that actually, you do need to look at what is impacting that organ system
Mhm.
that maybe you could do a bit of help with.
Yeah. And it reminds me of the conversation we had about anxiety when
Mm-hmm.
we're talking about the liver.
Mm-hmm.
And that one diagnosis will
Yeah.
have a million different patterns that it could possibly be.
Yeah.
And that's the same thing with anything digestive. It could be just so many different patterns. And generally speaking, like when I was
Mm-hmm.
talking about back pain,
Mm-hmm.
there are points specific
Mm-hmm.
for supporting the digestive system, which you probably always include in the treatment plan. So you're using points that are meant to help digestion, but you're
Yeah.
also, treating the underlying pattern.
Mm-hmm.
And you're hoping that by treating the root cause, treating that underlying pattern that's really out of balance, that you can actually like get around just managing symptoms,
Mm-hmm.
which is a lot like what we do with medication, which is
Mm-hmm.
fine.
Yeah.
There's always a time and place
Mm-hmm.
for Western medication, for medical intervention. There's always,
Yeah.
especially if it's super severe. But if you've got it under control, things like this is totally off topic, but like blood pressure, for example, that's a
Yeah.
medication that it's actually quite easy
Yeah.
to use acupuncture to lower your dosage or
Mm-hmm.
completely come off
Mm-hmm.
with your doctor's
Yeah.
approval,
Yeah. Yeah.
obviously,
Yeah.
and supervision.
Yeah.
But yeah, and it's kind of that way for digestion as well.
Mm-hmm. Great.
Yeah. And then
And
what was the third thing?
we talked a bit about headaches and
Oh,
migraines.
headaches and
Mm-hmm.
migraines. Oh, I love this
Mm-hmm.
one because headaches and
Mm.
migraines are so responsive
Yeah.
to acupuncture.
Yeah.
I'll just give a little
Do
aside.
it. I'm
My
just catching.
my boyfriend has migraines. Bless him, he won't mind that I say this. And as soon as he feels them coming on, I go, all right, acupuncture treatment time.
Mm.
And they're quite, sporadic now, but when
Mm-hmm.
he drinks caffeine, he
Yeah.
gets them. And
Uh,
he loves caffeine these days.
yeah.
So
Yeah.
so I
Yeah.
put the needles in him and in 20 minutes he'll have a little nap, he'll wake
Mm.
up and the migraine's gone.
Nice.
There's no headache at all, and the only side effect he has is like a little bit of that like fuzzy headedness
Yeah.
for, 24 hours, but
Yeah.
it's no longer crippling. You're no longer writing off your day.
Yeah.
And again, migraines, like can stem from tension. So we
Yeah.
need to figure out what's happening with the migraines.
Yeah.
But there's a
Yeah.
lot of different patterns that they
Yeah.
can be, and just
Absolutely.
pinpointing them and kind of working with them.
100%.
It's really, really helpful for
Mm.
migraines and headaches. Super
Yeah.
easy. I mean, it's like
Yeah.
that one's
Mm.
child's play.
Nice.
Love that one. Yeah.
Right. I'll be here. So how can acupuncture express through movement, and how does this show up in your yoga teaching?
Oh, okay. Well, I think actually we could talk a little bit about like Qigong too
Oh,
in
love it.
this,
Yes.
which is a beautiful practice that,
Yeah.
really corresponds to acupuncture
Mm-hmm.
because you're working with the energy channels of the body. But, yoga is something I teach.
Yeah.
And so there's different channels, some run on the inside of the leg, some run on the outside, some are on the
Yeah.
front side of the body, some are on the back. There's just points all over the body. So essentially, in Qigong, sometimes you're really trying to like activate one
Mm-hmm.
area of the
Yeah.
body to like
Yeah.
stimulate the meridian.
Yeah.
Um, in yoga, you sometimes have very, very like hard postures.
Yeah.
But in Qigong, and when you're thinking about meridians, the
Mm-hmm.
most important thing in the body is to create the free flow of qi.
Yeah.
And I think that's something that osteopathy does really well,
Mm-hmm.
is creates movements within the joints instead
Yeah.
of locking everything out. You have
Mm-hmm.
these little micro bends
Yeah.
where you allow everything to kind of flow freely.
Yeah.
And that's also one of the things in Qigong is in your posture,
Yeah.
you're never locking anything out. You're kind of creating
Yeah.
space in all of your joints.
Mm-hmm.
There's like a lifting
Mm-hmm.
instead of a sinking down
Mm-hmm.
into.
Yeah,
You might
absolutely.
ground down, but
Mm-hmm.
you're never like
Yeah.
compressing. So
So
expansion.
absolutely. So a good friend of mine in Switzerland is an acupuncturist and practices Qigong, and she did a guest session on the retreat for us. Yeah,
Oh,
and it was really lovely, and I share quite a lot of her stuff on Instagram as well. And it is so supportive to that process, right?
hmm.
Um, and do you think that you like separate your yoga and your acupuncture practice more, or
Well, for
is it
me,
blending a little
it's
bit
kind of
more?
difficult because I have a very Western mind
Yeah,
and then I have an Eastern kind of woo-woo
yeah,
mind.
yeah.
And I do not keep them completely separate, but I
Hmm.
do not always merge them. And
Yeah.
I have 3 years of teaching on the reformer before.
Oh, yeah,
Well,
that's right. I keep forgetting
yeah.
that. We have got to talk about that at some point, you and me together.
We'll talk about that. I love the reformer.
Yeah.
And, I taught yoga for about 10 years and then
Yeah.
I've come back and I've started teaching it again
Nice.
because I'm not teaching reformer, which reformer is the love of my
Yeah.
life.
Yeah.
But there's, in movement patterns,
Yeah.
there is a lot of holding
Yeah.
and I love strengthening and conditioning. Oh,
Yeah.
do love all of it.
Yeah.
Um, but I think with all of it, there's just always got to be that aspect of non-compression.
Totally.
Like in
Hmm.
everything.
Hmm.
There's flexion and
Yeah.
there's that muscular contraction that we're all looking for, and then also like the lengthening of the muscles,
Hmm.
obviously. But
Hmm. Hmm.
yeah, I'd love to say that every time I teach a yoga class, I'm thinking about how to like create the
Mm.
free flow of
Mm.
chi, but really, I'm thinking more about
Yeah.
like how can I get every single person in here to breathe
Yeah.
and like expand their diaphragm
Yeah.
and just like tap into parasympathetic. And I
Nice.
and that's my Western brain
Absolutely.
because
Yeah.
on the table when you're
Yeah.
doing acupuncture, I'm just like drop out of your
Yeah.
sympathetic nervous system. You
Hmm.
need like this is where the body heals. It's the only
Absolutely.
place the body can heal, right? Is in parasympathetic. It's
100%.
yeah. So
100%. Yeah. Great.
yeah.
Thank you so much. I
Thank
really,
you.
really enjoyed this.
Thank you for all your great questions.
You're welcome.
Gosh, it's been so fun geeking out on this. I
Good.
never get
We
to talk
are
about it.
complete geeks. We'll see you soon.